Hi guys, welcome to A to Z Medicatrix. In this video, we are going to discuss about anatomy of female reproductive system with a clear-cut explanation of external genitalia. Let's get started. First of all, female genital tract is a component of three things. For our understanding, anatomically, we divided into three parts: external genitalia, internal genitalia, and accessory reproductive organs. In this video, exclusively we discuss about external genitalia. First of all, I would like to mention one point that this video may be helpful for the students who are going to write anatomy or gynecology obstetrics exam, as well as it is also helpful for the doctors who are going to write competitive exams or in their general practice. Let's start with the external genitalia. External genitalia is also known as vulva or pudendum. Wherever you come across the word vulva or pudendum, it is nothing but a external genitalia. So this vulva is a ill-defined area comprises of whole external genitalia. Here in this picture you can see it is a total vulva we call as external genitalia, including the perineum. Let's continue. It is bounded anteriorly by mons pubis, laterally by labia majora, posteriorly by perineal layers. Here I mentioned the parts of vulva one by one. Mons pubis or mons veneris. Here you can see mons pubis or mons veneris. Other part is labia majora on either side. Labia minora, inner sides of labia majora. These are the two labias. Labia is nothing but a lips. So the upper lips, the outer ones are labia majora, the bigger ones. The inner smaller ones are labia minora. The other parts are clitoris. Here you can see clitoris. And vestibule. Vestibule is nothing but a triangular space in the vulva. I discuss later. And perineum. Perineum also we discuss later. Let's start one by one. First we discuss about mons pubis. Mons pubis is nothing but mons veneris. It is also known as mons veneris. It is a pad of subcutaneous and adipose tissue. It is a pad of subcutaneous and adipose tissue and covered with a lot of hair. You can see hair here. It consists of folds of skin which encloses the variable amount of subcutaneous dense connective tissue and adipose tissue, and it also having the sebaceous glands and sweat glands and hair follicles. Here one important point is that posteriorly these two lips, labia majora, they posteriorly fuse together and forms posterior commissure. So this part is posterior commissure. This labia majora richly supplied by venous plexus. That's why there is a chance of formation of hematoma clinically when if there is a labia majora injured, maybe during childbirth or maybe during accident or while playing. This is homologous to scrotum of male. These kind of points are very important while writing the exams. They may give 2 or 3 parts and they ask us to match. So labia majora is a homologous to scrotum of male. Then come to labia minora. Labia minora are nothing but two thick folds of skin which is devoid of fat either sides just within the labia majora. Come to picture. This is the labia majora. The inner layers, if you see, these are the labia minora. These layers, like both sides labia minora, anteriorly encloses the clitoris. In front, it forms a prefuse of the clitoris. Behind, it forms the frenulum of the clitoris. let's come back to the picture again. So this labia minora layer, they come anteriorly, covers the encloses the clitoris. The in front it forms a prepuce. This is a prepuce of clitoris. Behind it forms the frenulum. Posteriorly, these two layers, minora layers, they form fuses. It forms fourchette. So this is a fourchette. The labia majora layers forms posterior commissure. So the gap between the fossa between fourchette and posterior commissure is known as fossa navicularis. Please remember fossa navicularis. The next part is clitoris. It is cylindrical and erectile organ of a female. It consists of glands, body and two crura. In the picture you can see this is a glands and this is a body and these are the two crura here I mentioned. So this clitoris is analogous to penis of a male reproductive system. This has a basically different, this is different with the penis by separatedly from urethra. It is entirely separated from urethra. You can see this is urethral orifice, but clitoris is here. But once it comes to penis, it is along with the urethral orifice. So that is the difference between penis and clitoris. The glans is covered with a squamous cell epithelium and richly supplied with the nerves. That's why whenever there is a touch or pressure on clitoris, female gets excited sexually. So under surface, it is attached to symphysis pubis by suspensory ligament. Please remember, this may be a question in the exam. Then come to vestibule. Vestibule is a triangular space bounded anteriorly by clitoris, posteriorly by fourchette, laterally means either sides by labia minora. Here you see triangular structure which is laterally by labia minora, posteriorly by clitoris and anteriorly by clitoris, posteriorly by fourchette. So what is the importance of this vestibule? There is a 4 major openings in this vestibule. One is urethral opening. Here you can see urethral opening. And posteriorly you can see vaginal opening with the hymen. And there is a 2 glands. You can see here. These are either side. One gland on either side. These glands have a ducts. They also open into vestibule. So majorly they call 4 openings, but why sometimes they say 6 openings? Why? Because there is a para-urethral ducts beside the urethral openings. These openings sometimes they may open posteriorly into urethral opening or sometimes they may open directly into vestibule. That's why whenever they open directly into the vestibule, then we consider openings are 6. Please remember, don't get confused. Urethral opening is just in the midline and in front of vaginal orifice and it is 1 to 1.5 centimeters below the pubic arch. As I mentioned earlier, paraurethral ducts open either on the posterior wall of urethral orifice or directly into vestibule. The next one is vaginal orifice and hymen. So it lies posterior end of the vestibule. We see vaginal opening here. This vaginal opening is incompletely closed by the mucous membrane septum that is known as hymen. This is very important. Please remember, this hymen is circular, either circular or concentric in virgins. But later in a parous woman or even after lacerated hymen during childbirth or maybe other accidents or other injuries, there may be formation of cicatrized nodules. Those nodules known as carunculae mictiformis. So please remember this point. This carunculae is related to hymen. The next important glands are Bartholin glands, and these two openings, the Bartholin gland ducts openings are open into vestibule. Bartholin glands they situated either side of the vaginal opening. Here you can see there are P-shaped two glands which have ducts of 2 centimeters on either side. These ducts opens into vestibule. So what is the importance of these Bartholin glands? Bartholin glands are nothing but they secrete the alkaline mucus when female is excited. This secretion helpful in the lubrication of vagina in order to prevent the painful coition. If there is no Bartholin gland secretion, there will not be any secretion during the intercourse. Then female may feel pain during coitus. This secretion happens due to contraction of bulbocavernous and it squeezes the secretions. Each gland duct is of 2 centimeters. This Bartholin gland corresponding to bulbourethral gland of male. Please remember, sometimes these may be the questions in the competitive exams. These ducts sometimes get obstructed and the fluid which is going to get secreted will come back into the gland and causes swelling of Bartholin gland, that is nothing but Bartholin cyst. And if there is so much pus formation or infection, that leads to Bartholin abscess also. Clinically, these two are important, Bartholin cyst as well as Bartholin abscess. Next, coming to the simple one is a vestibular bulb. It is nothing but elongated masses of erectile tissue either side of the vaginal orifice. Here you can see either side there is a elongated tissues called vestibular bulb. It is incorporated in the bulbocavernous muscle. It is homologous to single bulb of penis or corpus spongiosum of male. So next one is perineum. There is a 3 perineums for our understanding. One is anatomical perineum, another one is obstetrical perineum, the third one is pelvic perineum. Perineum itself is a vast topic. We discuss perineum in a later videos. Here please remember one point. Obstetrical perineum is nothing but a perineal body. Whenever you come across the perineal body, that is nothing but a obstetrical perineum, which is helpful in the episiotomy during normal delivery. We discuss these points in a later videos. Before going to talk about blood supply, nervous supply of the vulva, I just summarize the points which we discussed till now. The external genitalia parts, if you see, mons veneris or mons pubis and labia majora, labia minora, clitoris and vestibule. Once we talk about labia majora, please remember posterior commissure. This labia majora posteriorly fuse form and posterior commissure. Labia minora anteriorly it fuses, it covers, encloses the clitoris. In front it forms prefuse, behind it forms frenulum. And posteriorly it fuses and forms foreshed. Fossa navicularis is the fossa between the posterior commissure and foreshed. Clitoris, once comes to clitoris, please remember the parts of clitoris, glans, body and 2 crura. This clitoris is the erectile organ of female. Next, vestibule. Vestibule is having 6 openings, majorly 4. What are they? Urethral orifice, vaginal orifice with a hymen and 2 orifices of Bartholin ducts. If you consider paraurethral ducts also as openings in the vestibule, then all together 6 openings. Then please remember clinical points like Bartholin cyst and Bartholin abscess. Then coming to hymen, hymen is an incomplete mucus layer covering the vaginal orifice. This is clinically important when there is a victims of rape. So these are the parts of external genitalia. Coming to blood supply and nerve supply of the vulva. Blood supply arteries, if you see, the branches of internal pudendal artery and the branches of femoral artery supplies as the blood to the vulva. And the venous drainage, the veins forms plexus are nothing but internal pudendal vein. The veins which forms plexus into internal pudendal vein, vesicle or vaginal venous plexus, long saphenous vein. So venous drainage into these veins. And nerve supply, if you see, ilioinguinal and genital branch of genitofemoral nerve, please remember, posterior cutaneous nerve of thigh and pudendal nerve. In exam, they may ask these three as options and a fourth one all of the above. So please remember all the points. I hope this video helpful for you for learning external genitalia of female. If you like this video, please share, subscribe. Thank you. Have a great day.